Hello, I'm Dr. Rohini. So today I'm going to talk about an abnormal semen test and how to go about it. So in my last episode, I told you what are the parameters that we check in semen analysis. That is the volume, the total counts, sperm concentration, the active motility or progressive motility, and the shape of the sperms. And again, whether there is any infection and semen culture and sensitivity. So now I'll tell you how we are going to grade it. So when the sperm count is less, then we call it as oligospermia. Speed or motility is less, we call it as asthenospermia. And when the shapes are abnormal, that we call it as teratozoospermia. So in what happens when, as far as oligospermia is concerned, how do we grade it? So mild is when the count is 10 to 15 million, moderate when it is 5 to 10 million, and severe is 0 to 5 million. So then this helps us in our management of our treatment, because 10 to 15 patient can still conceive naturally, but when it becomes 5 to 10, patient is advised to go for an advanced procedure called IUI, that is intrauterine insemination. And then when it is less than 5 million, we advise the patient to directly go for advanced reproductive techniques like IVF. And now the next parameter that we see is the speed of the sperms, that is total motility. So asthenospermia, in case of asthenospermia, again, if the counts are completely normal, but the motility is very less, in that case also the natural conception will not happen. So then again we will advise the patient to go for IUI, where we are going to separate and get good quality sperms which are highly motile, and we are going to put it directly inside the uterus at the time of ovulation. So next what we see is the morphology, the shape of the sperm. So it's not enough if the speed is good and the total count is good. It's also important that the shape of the sperm is also good, because if the shape is abnormal, sometimes we have sperms called pinhead sperm, or when the shape is not good, globospermia, these kind of conditions. The sperm, even the count is good, the sperm will reach the egg in the fallopian tube, but it will not be able to fertilize the egg. And even if the fertilization happens, the implantation will not happen. Even if the implantation happens, we have seen in some patients, they tend to have recurrent pregnancy loss, or they will have abortion very early on, around 4 to 5 weeks. So it's important that the shape of the sperm is also important. Now, other than that, again, the volume of the sperm, if it is less than 1.5 ml, it's called hypospermia. And also the presence of fructose in the semen. This gives us an idea whether there is any duct obstruction somewhere in the pathway of semen secretion, ejaculatory duct obstruction, that will be known. So now what to do next if you have a abnormal semen test? So first of all, we also order certain other tests. In case the count is less than 10 million, we ask the patient to get the hormonal evaluation done, like FSH, LH and testosterone levels are checked. And based on that, we start the patient on medications. And also we do an ultrasound of testis to see if there is any abnormality in the testis, if it is small, or if there is any swelling of testicular veins, that is called varicocele. So accordingly, based on the report, we will treat the patient. Now, if there are other certain lifestyle modifications that we advise to the patient. First of all, we ask them to reduce stressful environment, avoid working in prolonged, very hot atmosphere. And then other than that, if they have drinking or smoking habits, we can ask them to quit those habits. And if they are on the heavier side, or if they are overweight, we tell them to exercise and reduce weight. So these are some of the lifestyle modifications. And other than that, we also start the patient on certain treatment drugs, that is antioxidants. These antioxidants will help in sperm production, and it will increase the sperm quality. According to evidence, some studies show that there has been improvement with sperm parameters. Some studies tell that there has not been any improvement, but what we have found in our clinical practice is definitely it does marginally improve the sperm quality. So these antioxidants are given for a period of 2 to 3 months. And usually we recheck the semen sample again after 3 months, because 3 months is the time that the testis takes for production of sperm. So we have to give that much time for the parameters to improve. And after that, we can come to a decision along with the hormonal test. If in case any hormonal abnormalities are found, then we start on hormone injections for the patient. That will also improve the sperm quality. So this is how we are going to manage the patient. I hope this was a very brief overview of what happens. There are a lot of treatments, lot of detailed discussions that have been going on how to manage male infertility. But for now, today I'll finish my video with just this small brief talk. If you have any doubts, please come in person and visit us. We can have a detailed chat about this.